My name is Yesol Yang. I'm assistant professor at the College of Nursing at the Ohio State University. I want to start my talk with one question. Could you raise your hand if you're those who are a bit uncomfortable with uncertainty? For example, do you create a very well-planned itinerary for each day when you travel? Or do you live by calendar? People who raise their hands might question might be those who have a high intolerance of uncertainty. In other words, those who have uncomfortable with uncertain situation. Intolerance of uncertainty is a tendency to experience discomfort and distress when faced with situations that are unpredictable or uncertain. Those who have high intolerance of uncertainty have tendency to seek certainty and control. Thus, they often show behavior like overplanning, reassurance seeking, and avoidance of uncertain situations. I had a colleague when I worked at intensive care unit nurse. She was brilliant, but was a person who had a strong discomfort with unpredictability. But imagine the ICU setting. Patient admitted to ICU had a very complex illness, and their condition changed every second. Whenever her patient showed unpredictable outcome, she described that her heart pounded, she couldn't breathe, and her brain stopped. She was the classic example of those who have high intolerance of uncertainty. Later, she moved to another working unit that better suited her characteristic. Intolerance of uncertainty is not simply preference for certainty. It is a more complex construct involving emotional, behavioral response to aversive experience of uncertainty. Intolerance of uncertainty has been known as a trait-like characteristic such as curiosity, but it is modifiable. Research shows that IU can be modified by psychoeducation, cognitive behavior therapy, meditation, or pharmacotherapy. IU has been known as a core construct of emotional and cognitive problem. Now we understand what IU is, and I want to understand why intolerance of uncertainty is important in young breast cancer survivors. Compared to older age group, young women often have a lower long-term survival rate and higher rate of recurrence. Also, young survivors face specific issues related to their age and life stage, such as interruption to education or career trajectory, and parenting young children. As such, young breast cancer survivors face greater uncertainty over the trajectory of cancer. They also tend to report greater emotional and cognitive problems compared to older breast cancer survivors. Given that young breast cancer survivor is more exposed to uncertainty, it is needed to understand how they respond to uncertain situations, and also it is important to understand how their reactions are related to their emotional and cognitive problem. There are several ways we can measure intolerance of uncertainty. We can measure it using self-report and objective methods such as eye blink reflex and neuroimaging methods. Self-report has an excellent psychometric property, but its usability can be diminished if participants misunderstand the test item. So in our lab, we use two objective measures to objectively measure intolerance of uncertainty. We use eye blink reflex measure, and we also use fMRI method. In both cases, we deliver mild but not painful electric current, which is uncertain in its timing to induce uncertain situation. And at the same time, we measure their eye blink reflex and their brain activation when uncertain threats are delivered. Those who show hyperbrain activation to that uncertain threat are those who have high intolerance of uncertainty. Also, people who show hyper eye blink reflex to uncertain threat are those who have high intolerance of uncertainty. In my previous study, I had one breast cancer survivor who reported low intolerance of uncertainty on self-report, but show hyperbrain activation when we deliver uncertain threat. As such, using both subjective and objective measures are incredibly important for getting accurate data. We can only get accurate data the more participants we have. Currently, I'm looking for participants for my study. In our lab, we are actively recruiting young breast cancer survivors who are age 45 and under, and those who complete chemotherapy within 12 months. We aim to investigate the role of intolerance of uncertainty on emotional and cognitive symptoms, and we will measure IU using self-report and eye blink test. If you know anyone who are eligible for our study, please reach out to us. Thanks for listening.